Hold on, can you hear me?
Can you hear me? I can hear you.
I can hear you. Perfect.
Excellent. I was just about to send you a text message to let you know that I was here.
Hello. I'm going to, everyone is going to be muted when they come in, but you're going to probably see them start popping up. So
Yeah, no problem. Give me a second. Are people going to be able to ask questions on the chat, or is that?
Yeah.
Okay. I have to give you guys a heads up that my 4-year-old son may be coming in the picture at any point in time, even though I specifically asked him to please not come in here.
It's okay. I have met so many children this week, so many partners, just things in the background, dogs.
Yep.
That's fine. Sorry if you can hear my typing.
It's okay.
Type less. My boyfriend keeps telling me I type very loud.
Yeah, all of a sudden in the last couple of weeks, Zoom has become like my second home. I've been spending a lot of time doing presentations and conference calls all through Zoom.
Yeah. We have Microsoft Live and Zoom, but I really like Zoom a lot more. It's a lot more interactive.
Yeah, I also use Google Meets, and that was interesting. But I think that my favorite one thus far is Zoom.
Yeah, Zoom is really nice. I like Zoom.
I try to get people to show their faces in the videos. Maybe we can get some people, even if their phones are muted, they can definitely show their faces.
Hey, Afra.
Hello, how y'all doing?
Hello, hello.
How's it going, Dr. Mercedes?
Doing well, man. Thank you.
Great, great. You and the family managing and all this craziness?
Yeah. So far, so good.
Okay, good.
Thank you.
It's definitely a change of pace for us as well.
Absolutely. So I took this coffee with Joe very seriously. I have another cup waiting for me for the intermission if there's one.
You know, I left my really cool mug in the office. I didn't even think
You did. You left it there. Oh, Spencer.
I don't know what I was thinking, really. So, Dr. Mercedes, we did a mug exchange for Christmas.
Mm-hmm.
And we had to, it was like a Secret Santa thing, you know, so we had to get a mug that reflected, you know, our gift recipients' like personality. So I think we all did like a good job of matching everybody's. And then Nick, one of the work studies, one of the undergrad students, got me a mug. And the handle looks like a guitar. I play guitar. So the handle of it is a guitar, and there's notes all over it. It looks really neat. But
that does sound pretty nice, man.
I'm missing it.
Yeah.
We'll give it another minute before we get started. I see people coming into the waiting room.
Professor Pritchett, so nice
Dr.
to see
Pritchett,
you.
hello.
Awesome.
It is a pleasure to see you.
Dr. Pritchett, you're on mute.
So I put on my headset because my kid won't let me hear. I just give you guys a heads up. Right now I'm hearing him running up and down the hallway. So you let me know if you pick up the sound.
I can hear. I don't know if you guys can hear him. I can hear Anthony on a conference call because he's in the other room because he works for a hospital. He works on the communications team and he has a conference call every day at 4 o'clock. And I can hear them, all of them behind me. So I think we can probably get started. We have 15 people on the call right now. Jen Mazzetti, are you on? Oh, I see you. You're on mute. We can't hear you. I can see you. I can see your lips moving. I think it might be your headphones.
I don't see her though.
I see her, but I can't hear her. Jen, we can't hear you if you're trying to say hello. I think it might be the headphones you're wearing if maybe you want to unplug them. Let's see. Well, we're gonna get started.
Hear me?
Oh, we can hear you now. Yes.
Oh, good. Finally.
Perfect.
And you can see me.
Jen.
Great.
We can hear you and we can see you.
Wonderful. Wonderful.
So we're gonna get started. Welcome everybody. This is our very first virtual Café con Joes. So you guys don't know me. I'm Anna. I'm the director of the Latino Institute, and here our guests today are Dr. Enmanuel Mercedes. Say hi, Manny.
Hello.
And we have Dr. Jennifer Mazzetti from Seton Hall.
Hi, everyone.
So today we're really gonna talk about mental health and really, all of us have been going through a lot lately. We're all going through this together. So I really appreciate the time that you guys are taking to come in and hang out with us for a little while. And I know here on the call, I have some of my team members, Afra, who's one of our work studies, and Spencer, who's our graduate assistant. I think Nick is on too. But thank you, Dr. Mercedes and Dr. Mazzetti, for taking the time today to talk to us a little bit. So I'm going to hand the mic over to Manny so he can introduce himself and start our chat off. So go ahead, Manny.
Absolutely. Thank you guys so much for your time and your attention. This has been pretty cool to be able to do this. Initially, we we had the idea of doing a mental health talk because we really thought that it's important to have this conversation. But as things progress, it's become vital. Believe it or not, in the last couple of weeks, I've been doing at least one of these or similar to these talks at least once every 2 or 3 days, with either mental health professionals who need support, teachers, medical staff. So it's become kind of very real very quickly for people that this is not only a physical health condition that could affect any of us, but it's also a mental health condition. So it is something that the mental health part of it is really affecting most of us at this point. Uh, Being home has taken a toll on a lot of people. Even if you feel like things have been relatively stable at home, it's still very stressful to not to have lose your routine. But I'll talk more about that. We'll talk more about that later on. I just, as a formal introduction, I'm an Seton Hall alum. I was there for a few years. Got there. Yeah, Professor Pritchett. So nice to see you. Professor Pritchett knows me very well. I was at Seton Hall for my undergrad degree in '98 to 2002, and then after that I stayed. First employed by the university as a counselor, and then I went on to get my master's and my doctorate degree also in psychology and counseling ultimately. So I was at Seton Hall, I think longer than I was a teenager, if I were to really count the years. And I've been involved with the Latino Institute in the past couple of years. As part of the advisory board, and it's been really an honor to be part of this organization, but also to be able to give back. And I've had the opportunity to do similar talks with students before, but this is really special because, again, I'm coming and doing this from the perspective of an alum, but also talking about something that at this point is a really, really big need that we have. Which is addressing our mental health needs. But I'll leave it at there. I want to give Jennifer an opportunity to also introduce herself and share with us, a little bit of her background. Microphone's still off.
Let's see. Can you hear me?
Now we can hear it. Thank you.
Perfect. Thank you. So, I'm very excited to be here. So a little bit about my background. I was born and raised in New Jersey, in Bergen County to be specific. And, I've lived here for many years. In order to go to graduate school, I ended up trying to find the right fit. So I figured with graduate school, it's such an investment of your time, money, resources, that you want it to be the right program for you. So I ended up going to University of Denver. And that was really a wonderful experience for me. And I've moved back here to New Jersey not very long ago. So I've been back here about a year. And I'm having a really wonderful time working at Seton Hall through the Counseling and Psychological Services Center. And it's really been great. A lot of my background has been focused on mental health in the Latino community. And a lot of what I've done has been around health psychology in the past. So I really enjoyed working with patients who had cancer, working and kind of organizing different support groups for women who were at various stages of either recently being diagnosed, going through treatment at the time, or then later kind of survivorship. Like, what does that look like after you go through something so difficult as that experience? I've really enjoyed kind of transitioning over to college counseling. I think it's a wonderful field. And there's just a really wonderful energy when you talk about, I think, this population, thinking about the needs of young students who are really coming into their own, trying to figure out their identity within their family of origin, trying to figure out their identity as a budding professional, and kind of making their way through the world. So I'm really excited to be here. Thank you.
Thank you guys so much for introducing yourselves. And, I think, we're all, like you said earlier, Manny, where this is an unprecedented time and we're all kind of going through this quarantine and self-isolation ourselves, for the university, on the university's part, spring semester has been essentially canceled, all events. and we're all doing virtual everything, virtual learning. You know, we're isolated from people that we usually work with, people that we see every day in class, and it's just not the same, you know, to go on Zoom and listen to your teacher. So I guess, you know, my first question to you guys is, you know, what tips do you have, or what can you tell us about how we can make sure that we keep ourselves mentally healthy while we're going through this, knowing that we don't know when it's going to be over?
Yeah, I mean, I think that first off, we want to recognize that the stress and some of the anxiety that we're experiencing as a result of recent events uh, are a natural reaction, in fact, to what's going on. I think that even as we are trying to put pieces together and trying to understand what's going on, we are on a constant struggle to also be in control. Um, and kind of like stress, it's your body's response to everything that's going around you, so that you can try to regain some control, so that you can try to remain somewhat stable. And sometimes can be a little bit overwhelming. So I bring that up because I think that it's important to know, one, that part of this is normal, meaning the reaction that we're having, but that there's going to be a part of it is about how do we manage our anxiety, how do we manage the amount of stress that we are experiencing, and being able to come out of this experience, in a sense with wellness, in the spirit of wellness, essentially. How do we manage this from a wellness perspective? And one of the things that I kind of like been saying time and time again to everyone in terms of surviving this is really kind of like recognize that social distancing is not necessarily the same thing as social isolation. And I think that as we were talking about managing our physical safety by creating space between us. We are social beings. We need to be in contact with others. We need to hear from other people. We need to to feel attended to, and also we need to attend to others. And there's a lot of importance in that, and that if we don't make a preemptive attempt, meaning if we don't plan it into our routine to stay in touch with people, it can become very isolating and very debilitating. So I've for myself, I have a routine in which every single morning I still have to go to the clinic as a health professional, but every single morning I call my parents and I call my brother. I mean, we've created a group chat, and I just call everybody at the same time, make sure that we stay in touch. And then in the evening when I'm going back home, I do the same thing. And then I have friends that I've kind of like put together in small groups so that I'm able to reach out to them as well. Because the idea is to maintain as much contact as possible, because this kind of situation does highlight certain aspects of loneliness that may have been there to begin with, but that now are being that can be enlarged as a result of the stress that we are experiencing. So I'll leave it at that because I don't want to talk. I can talk for 2-3 hours straight. But Jennifer, what do you think?
Thank you. So, I definitely agree with what you're mentioning. It's really important, I think, to be thoughtful in trying to plan those interactions. I think that's really helpful. One thing I've noticed, I think the idea of being flexible, I think that really comes into play. So I think it's good to understand that, in some regards, like you mentioned, this is definitely a normal reaction to a very abnormal situation, right? This is something we were not thinking about. This is not something that we've seen before. And I think it's really helpful to give ourselves kind of that leeway, give ourselves a break and say, okay, I'm going to plan my routine. I'm going to plan trying to be social. I'm going to plan all of these things to really invest in my mental health and my well being. But I also know I'm not perfect, right? The human condition means by nature, by definition, I am not perfect. And if I do find myself having a bad day or a bad moment, I need to also understand that's part of the process of any change. So I think that's really important to not judge ourselves. If we realize, okay, I haven't been able to really do all of the things I was planning on doing, that's okay. At the same time, I think it's really important to just try to be resourceful. So I think it's been nice because being part of the mental health profession, I've seen so many people volunteering, trying to come up with new plans, different workshops, a lot of different resources out there for Seton Hall students, but also for the community at large. So I always say take advantage, right? Take advantage of any avenue that you think would be helpful for your mental health. So, being part of Seton Hall and CAPS, we've been trying to think of a lot of different initiatives. So I would encourage you to kind of keep checking on our website. And I actually just finished a series of kind of guided mindfulness activities. So that will soon be up on our website. But there are 3 in English and then 3 in Spanish that will be available soon. And we're very excited about that. And along with that, I would just say, try to be creative. You see wonderful things on YouTube about people even kind of dating, right, during this period of social distancing. So I think there are all these really interesting ways to be connected. So that would be my encouraging words, I think, for you guys. Yeah, thank you.
In terms of, thank you guys. I think both those messages we can all probably relate to, since we're all in this together, and all of us are trying to find ways to keep connected to the people that we love. And like you said earlier, Manny, I call my mom also every day at 8:30 a.m. and then I call her at night and we FaceTime because we're not able. She's over 60, so I'm not, and my boyfriend works in a hospital, so I don't ever want to put her in a compromise her health in any way. So I've tried to stay away from her as much as I can. But I guess, in terms of, maybe if we can talk a little bit about dealing with our families, and in case, I'm quarantined with my boyfriend, but for students who live with their parents and with their siblings, how do you mitigate balancing schoolwork and making sure that your parents still understand that you are still in class, even though you're not in class. And that doesn't mean that you're extra available. You still have schoolwork to do while dealing now with your parents or your siblings or anyone else who's in your house.
Jennifer, you want to go first, since last time I went first?
Sure. Okay. So I think whenever possible, really open and direct communication is key. So every person has a different circumstance in terms of the family dynamic, or even if we think about things as simple as kind of physical space, right? Some of us have a little bit more of that privilege of having maybe a bigger home or a bigger area where we each have a little bit of privacy, but that's not always the case. So I think being very transparent would be helpful. So letting parents know, you know what, I think I'm making myself this schedule. So Tuesdays and Thursdays are my 2 big days for school and class. While I'm not actively on campus, please let me put a little do not disturb sign on my door that shows between maybe 8 a.m. to 12, I'm actually listening to an online class, or I'm actually doing homework or studying for a quiz I'll be having soon. So I think just kind of promoting it in different ways would be really helpful to let our families and our friends know that we still have a lot of responsibilities. We might not be commuting, we might not be on campus, but that doesn't change our identity as a student or as an employee or someone who needs to get things done. So I think that's really kind of the first step in all of this. Yeah.
Excellent. Thank you so much for sharing that. Communication absolutely is the focus, the primary key in all this. I'll add this to what you're sharing. And I'll give you an example, actually. I was just recently talking to one of my clients and for my private practice, who was sharing with me his frustration with mom, because mom, from his perspective, was too anxious. She was taking this way out of proportion, and in addition to that, she was interfering with all his activities. Pretty much anything that he was bringing up, there was an issue that she was having with it. And when I spoke to him, I asked him, well, what's been the communication? And essentially he said, well, I told her I have things to get done, and she says she doesn't care. And of course, that led to just, more conflict because in her mind, whatever she thought was important was the most important, right? And for him, whatever he thought was most important was the most important thing. And so that led to ongoing conflict nonstop. So I asked them to, as an exercise, to give me his perspective, his mom's perspective, if he were to describe it for me, just to give me kind of like what did he understand was mom's concern. And he was like, well, she's worried about me leaving the house. She's worried about me, and I like, but explain to me, what do you think that's coming from? And the idea of that exercise wasn't so much so that he can channel mom for the sake of channeling mom, but just so that he can try to gain some perspective on mom and build a little bit of empathy towards her. Now, it's not that uh, telling him whatever is important for you is not important for me was necessarily right, but how do we manage that? And I think that since I'm working with him, I'm able to give him some tips about kind of like uh, understanding, first of all, how stress can impact the other person that you're talking to. And so in mom's case, mom's extremely stressed because, and this I happen to know because of the work that I'm doing with them. Mom is stressed because of the work, and mom is also stressed because of the pandemic. Her work schedule has changed significantly, so she's worried about financially what that will mean. But also with regards to the pandemic, the concern about them becoming sick, and then they have the grandparents living at home, and they're worried about grandparents becoming sick. So there's a lot of stress from that perspective. So we work towards kind of like being able to express to mom some sense of understanding about her, not whether the garbage was important or not whether having dinner at a specific time was important or not, but just kind of like being able to validate mom's sense of frustration, or being able to see mom's stress and respond to that, and being sympathetic towards it, and then being able to see if they can communicate about how to help each other deal with each other's stress. And that was helpful for them because now when he spoke to her, he wasn't so much trying to be defensive about trying to prove or make his point. It is true he had work to get done, but every time they got into a confrontation, it just led to wasted time. It led to really negative emotions between them. So instead, I got him to just tell her, like, listen, I see that you're really stressed, and I see that you're really worried about these things that are going on. Is there anything that I can do to help? Maybe there's something that I can do to support you through all this. And then while doing that, and once they were able to have an open communication about that, then you can share with her what are some of the things that you are experiencing and some of the things that you would need in order for you to receive support from her. And he was able to say, well, yeah, like I need from 3 to 4, I have to be on a call. So I need her to just kind of like not bother me from 3 to 4. I don't have to worry about her coming in the room and telling me that I forgot to take out the garbage. And I'm like, okay, so have that dialogue. And so in being able to communicate, it is really important to recognize the other person's emotional experience, recognize the state that they're in. And once you do that, it opens up also the opportunity for you to be able to share with them your emotional experience and where you're at and what is it that you need in order for you to also have your needs being met.
I'm curious to know. Oh, I'm sorry. Go ahead, Jennifer. Before I ask.
I was just going to say, I couldn't agree more. And I think it's just so important to realize that we're not necessarily born with this skill set, right? It's a very unique skill set to kind of understand how we can identify our needs and then also learn to advocate for them with other people in our lives. And I think one important thing is that we want to focus on learning how to ask for what we need and how to help other people express that to us, but also sometimes being able to say no, I think is just as important. And I feel like within our community, when you think about the Latinx community, that's a very hard thing. I think a lot of times we worry that we're being selfish, we're not being a team player, we're not being part of the family. If we need to say, you know what, I actually can't do that, I need to do this instead. So I think that's something to think about, just like different ways to be able to say, okay, this is what I can do. And maybe we can negotiate on certain specifics, right? If I can't do this, there's something else I can do later in the week after my big exam or something like that.
Absolutely. Totally agree.
I'm curious to know if any students on the call have any questions about the communication piece of it, or if anyone is, struggling with maybe communicating with those people in their houses.
I don't have a question, but I just wanted to comment on what we just said about the power of no. I think personally, it's definitely very hard to say no to people. I'm a people pleaser, so I like to help people around me. And I don't know, do you have any, I don't know, tricks or tips or anything on just making that process easier, like the idea of saying no to others?
So I can say, one thing I find pretty helpful is to not so much focus on the outcome of the conversation, but really focus on the intention. So we can't control how another person will respond to our no, right? We hope that they can be understanding. We hope that they can be kind of gracious about it. But I think what's really important is trying to say, okay, no matter what happens at the end of this interaction, I can walk away saying that I feel that I was genuine, that I was true to myself, and I was still respectful of the other person's needs or wants. And I think that focusing on the intention can be a nice way to not put so much pressure on ourselves, right? Because usually we think about what are our main values? Like, how do we operate in this world? And you can be a very helpful, considerate person and still sometimes have to say no.
Yeah, I think that when we think about the word no in from a values perspective, and particularly when we're thinking about family and friends, there's a sense of like we are letting them down somehow, or we are disappointing them somehow. And it could be that they may express disappointment because you're saying no. But being aware that just because someone is interpreting that as disappointment, it doesn't mean that you still don't set healthy boundaries. And the truth is, it is uncomfortable sometimes to say no to your parents. Not sometimes, probably like 99.9% of the time, it's uncomfortable for me to tell my mom, no, I'm not going to do this. And I still uh, have had to evolve to getting to that point. I don't think that I was able to really say how I felt about something very clearly until my adult years. And that's probably because I started my own therapy, and I was able to get some feedback on the fact that I was kind of like pleasing my parents in everything, even when I was frustrated or upset, or even if it was to my own demise. At the same time, it's not like I don't care about my parents. So I was able to disconnect the idea of no means I don't care, or no means I'm being disrespectful, to simply understanding in this situation that I'm in, no means I'm setting a healthy boundary for myself because it's what I need at this point in time. So kind of like making sure that you're not uh, always mixing the no with the value of whether you are respecting someone, or you are necessarily not caring about that person, or not, showing support. They're not always connected.
Thank you.
Anyone else, or any other thoughts?
Can you hear me?
Yes.
Yes.
Okay, so I think for me, something that I feel I'm struggling with it is I have a younger brother, so even though my parents are still working online, I feel I have now the responsibility to help him with homework and kind of do the teacher's job, and that also gives me more stress because I'm adding that to my already busy schedule that I have because of my classes and tests that I have in the future and that I have to study for. So even though my brother is not the one who asked me for help, I'm the one who feels the need to put that on my checklist, on my to-do list on a daily basis. So what advice would you have to maybe set those healthy boundaries when I feel that I mean, like, I think this is just me because my parents, they're not asking for they're not asking me to help him on a daily basis, but just because of the situation that he needs guidance, that I feel like I know better so I can guide him and make it easier for him as well.
Jan, do you want to take this first?
Sure.
You want me to go first?
I can go. Thank you. Well, the first thing that kind of comes to mind for me is the idea of being flexible. So I think one thing that can be helpful is sometimes having certain goals or things you want to accomplish, per day. But I think sometimes giving yourself a little bit more leeway. So saying, okay, my main goal is to spend maybe 2 hours kind of tutoring my brother this week, right? That can be kind of a goal for the week, but that leaves you with some flexibility. If maybe you're really busy on Monday and Wednesday, you can move things around and say, okay, I'm going to maybe do this on Tuesday and Thursday. Or you can kind of move it around depending on how the day is going. So I think that way it leaves you more room to be successful. Because if I always say I'm going to commit 100%, those 2 hours I'm going to do tonight, if something comes up, I think it makes us feel like, oh, we failed, or that did not go according to plan. And then we kind of start beating ourselves up over that. So I think that definitely is one idea, just in terms of something a little bit more logistical or a little bit more practical. And then I'll let Manny kind of add a little bit to that as well.
Yeah, thank you. Uh, the one of the things that I've been seeing with a lot of the both the teachers and the parents who have been dealing with this homeschooling situation is this sense of frustration because despite thinking that they have enough time, it seems like they never have enough time. Um, there's so much going on. There's so much with regards to your own personal work. I have teachers who are also parents, and they have to take care of their kids at home and also do the schooling thing for the other kids, and it's extremely frustrating. So, in addition to the part about flexibility, there's a really key component about managing expectations. Now, with the managing expectations, the school systems are figuring this out as they're going along, which means that no one really, even the schools, were really prepared for this. And they've put together, everyone is doing the best that they can to try to manage this, and they put together packages for kids to complete at home and be given homework assignments and this kind of lesson plans. And they're discovering that some of these kids can spend 4, 5, 6 hours doing work and still not get it done, but the parents don't know that, or in your case, as the older sister, you may not know that the amount of work that is being sent your way is really overwhelming, right? And so you end up kind of like in this situation where you are constantly dealing with a state of frustration because you just don't have enough time, or you're feeling overwhelmed because you have other responsibilities that you also have to attend to. So what everyone is starting to do at this point is managing expectations, meaning they setting a minimal amount of work that needs to get done, right? If there's 10 assignments, out of these assignments, what are the 1 or 2 assignments that must be completed? Everything else is bonus, right? I'm going to try to get this one done. We're going to spend half an hour getting this part done, or an hour, depending on how much time I have. And after that, if I'm not able to get it, I'll communicate with the teachers with regards to what is their plan of action. Because believe it or not, this actually is the position that 56 million kids across the nation are in right now. Right, so we're not alone. I mean, my kid is only 4, and so our homework is a little bit differently at this point. But even that, like we have to figure out who's going to be doing what whenever we got to get on a call. Like right now, my wife is attending to him. She's doing the best she can. She's pregnant right now, so she's probably like 2 steps right behind him across from living room to the bedroom. And so when we need to sit down with him to do some of the writing assignments that he has, it can be really overwhelming because we already have 1,000 other things to do. So minimal expectations. What is it that needs to get done today? And then communicate with the teachers if you're the one doing the communication with them, or inform your parents so that they can inform the teacher about what their expectations should be. One of the things that's happening is some school systems are shifting away from grading some of the homework assignments, is just doing pass and fail based on the number of assignments that I get done. Find out what is the minimum that needs to get done if you feel this responsibility for your brother, that you feel like you need to help him, because it sounds like it's also something that you are imposing on yourself, right? You're like, I need to do this, right? And then once you have the minimal, also be aware of what are your limitations. Maybe it is not that you help him for an hour a day. Maybe it's 45 minutes. But trust that in that 45 minutes, you can give him your best 45 minutes or your best half an hour, and then balance out the other things that you have to take care of. And that's kind of like giving a direct advice, which we often don't do, but just putting it out there.
Thank you so much to you too.
No problem.
You guys brought up a point about, or you just did, Manny, about, expectations and anxiety. Can we talk a little bit about maybe, if can we talk a little bit about maybe for someone who has never felt these levels of anxiety before, like how do we grapple with some kind of new feelings? Like maybe if you're not used to, such high levels of stress and unsettling and anxiety, how do we kind of grapple with those are new feelings we have to deal with, but also how do we accept that those are feelings that we're going through right now, and it's okay.
So I definitely, I'll go first, but I definitely want
Yes,
to hear what
please.
Jennifer has to say, because she just put a mindfulness modules together, and I'm big on mindfulness, because I think this is what helps us, will help a lot of people work through some of this. There is a lot of kind of self-imposed expectations about what needs to happen or how things should be, and uh, when we are focused on how either things were before or how we think things should be, or where we wish we were in the future, meaning like we're focusing on, let's say some of us are thinking about July and August being today, like we're dying for this time to be done. In that particular moment, we are responding or reacting to not the present. We are just engaging in a reality that is not existent at this point in time. And that can be very anxiety provoking, because there's nothing you can do about the future that is not here yet, right? You're trying to solve a problem which hasn't arrived yet, or trying to kind of like predict what's going to be happening so that you can address it when it's not here yet. And the truth is that part of managing this anxiety is being able to uh, stay in the present moment. There is going to be some distress coming from this, because we are in a stressful situation. Those emotions are actually healthy in a way, because they help you to make movement towards taking care of yourself. Uh, on the other hand, you have to be cautious not to be caught up in your reaction to the stress, in your internal reaction, your internal dialogue to what's going on around you. Because there is a lot of negative self-talk right now about how this is going to impact us, what's going to happen. I was talking to a parent earlier today before coming in the call, and essentially her talk about where her child was, I'm worried that my kid is going to be behind academically come next year, and how this is going to impact them down the line, and he might actually end up having to need additional assistance because he's already struggling academically. And she has this entire narrative that I'm here listening to it, and I'm getting nervous just listening to something that hasn't happened yet. Right. So it is really important to be able to be aware that there are stressful situations that we have to respond in the moment, but to be aware of being in the present rather than being reacting to things that are part of our narrative as we are going through this. So Jennifer, take it away.
Thank you. I definitely am super on board like you are with mindfulness. So I think it's a wonderful kind of built-in break from worrying about the past or worrying about the future. So, the way I view it, I'm very big into the mind-body connection. So I always view it as the idea that the mind can follow the body. So if we're feeling very anxious, very agitated in different ways, I think it's really helpful to start connecting with what is actually going on in my body. Physically, what am I noticing that could serve as that signal that something's up, right? So is that maybe getting headaches? Is that a tummy ache? Is that feeling like my shoulders are really tense? Do I feel this change in my body? And if I start becoming more aware of this, it gives me an opportunity to catch this a little quicker. my goal is never to really just 100% shut out anxiety, because that's not a very realistic experience as a human. So I really want to acknowledge it's there. I want to say, okay, some of this is very normal. And then what can I do in terms of being proactive? What steps could I take to be in tune with my body and then act accordingly to help manage some of this anxiety? So I think that's really where a lot of this mindfulness comes in. There really are these wonderful audio clips, there are different videos, there are different things available online where you can really spend, sometimes something as short as 3 minutes can make a very big difference. And then they have a lot of different times in terms of like 10-minute ones, 15-minute ones, 20-minute ones, where you can kind of just feel it out. You know, there's not necessarily this big commitment. If you say, I don't know if this is for me, I always encourage you just to try it. You know, it's not going to harm anything. But I think a lot of people really realize that, wow, I actually feel a lot better after doing this. It was really quick and easy to access, and there's a lot of free material out there. So I think that's one thing all of us can kind of tap into moving forward, trying to figure out, how do I connect with my body? How do I understand what to do about it? And then maybe this will become more of like a practice for me ongoing. Even after everything settles down a bit with the coronavirus, how can I make this a part of my self-care routine? You know, I think we throw around that word or that phrase a lot, self-care, but what does that look like? It's kind of, I think, a trial and error procedure. So what works for me might not work for you. And that's okay. You know, we're all different. We have different personalities, different experiences, and different lifestyles. So for one person, maybe self-care is really going and hiking almost every day. For someone else, maybe it could be something as simple as putting together a puzzle, or reading, or listening to music. So I would encourage you to really spend this time where it's almost like a little bit of a forced exercise in self-care, to actually try to use it to your advantage. And then hopefully this is something you can take in the future that would help you in other stressful situations.
Another piece that I will add to that is the concept of self-compassion is gaining a lot of traction, because what you're talking about is, if you, and this is to, you know, when I explain it to some people, it's sometimes a little bit abstract. So what I'm going to do is just give you an example of how I envision it. If your friend came up to you saying, this is my experience right now, and it was exactly what you're describing, feeling tense, having headaches, I'm feeling agitated, everything is bothering me, I can't concentrate. What would you do to help that friend feel better? What could you do to care for that person, right? The self-compassion idea is to be aware of what the experience is, and then take an action to care for that need that is being presented. And so we sometimes can do it for other people with much more ease than we can actually do it for ourselves. And the reason for that is because we have a hard time thinking about what are some of the things that I can do to take care of myself, when we are being critical of ourselves, or we are being, you know, kind of like hard on ourselves for not being able to be able to handle things better. Why am I so stressed? I shouldn't be letting things stress me out so much, and kind of like this judgment takes over. But if you were talking to a friend that way, you probably wouldn't be considered much of a good friend, right? Like if you look at your friend, like, why are you stressing out? You must be nuts. Like, relax. Like, stop it. Like, you wouldn't talk to your friend that way. You will be like, you know what? Take a moment. Do you want to drink a water? Do you want me to get you some juice? Maybe you should take a nap, right? How often we tell people take a nap, but we would never think that we may need to take a nap at any given time. Like, just break our time up a little bit, rest, maybe do something that distracts you a little bit, and then go back to the task. Whatever it is that you would recommend to a friend to do to take care of themselves, consider it for yourself. And that's, you know, an active practice of self-compassion. All right.
Why do you think it's so hard for people to actually do that? And I know, I don't know if anyone else is struggling with this, but those exact feelings that you're saying of like, why am I letting this stress me out? Like, at least for me, like, I know just personally, like, I know that I'm extremely lucky to be able to still do my job, be home, and keep everything running almost normally. And I think, why is it so hard for people to accept that maybe, you know what, it is time to shut off the computer and take a nap, or you know what, I do deserve to just be in front of Netflix for an hour. and not be, forcing myself to do something if you're not concentrated.
Right.
So
Can you
I
guys
don't
hear
know,
me?
Manny,
Oh,
if
go
you'd
ahead, Jen.
like to
I'm
go.
sorry. Sorry, something popped up here. I'm trying to get out the screen. Go
Oh,
ahead, Jennifer.
sure. So, I think it's just very interesting because, Manny, as you were mentioning, kind of this idea of using your friend as an example, that's something that comes up so much in therapy and a lot of the clinical work I do, because I think it's a nice way to give ourselves permission to really be considering ourselves a friend. I think we talk a lot about relationships in therapy, clearly, but a lot of times I think the focus ends up being relationships with others, which obviously is a big part of our everyday experience. But I think there needs to be more of a shift into really understanding the relationship we have with ourselves. That impacts so many things like our self esteem. It impacts the way we operate in the world. It impacts the way we go after our goals in this life. And I think we really need to understand that no one is perfect, and that includes us.
Mhm.
It's kind of the idea that we are able to give permission for other people to sometimes mess up, right? Or maybe not succeed. But it's really hard for us to do that to ourselves. And I think it's important to talk about this. I think one way to combat that is really being very transparent and vulnerable, because that is being vulnerable, right? Saying, like, yeah, sometimes I feel really angry at myself, or sometimes I feel like I'm just failing at everything. And the more we're able to talk about that, there's less stigma. And I think having those conversations like we're having today, or maybe more of those private conversations with our family members, our friends, I think it really helps us feel connected. That's true intimacy that we're developing, even in a time of social distancing. I think that's really important.
Thank you so much for sharing that piece. 'Cause I think that is so important, uh, to be able to allow ourselves to be vulnerable and share with other people um, our insecurities or our fears. And I mean, it's the in the truth being that many of us, if we were to be really honest, are experiencing exactly the same thing. Um,
Mhm.
and but we're keeping it to ourselves, which makes it very isolating and makes it terrifying, and paralyzing. And if you think about like the effects of that anxiety may have on a person in terms of like fear of flying, or fear and wanting to flee the situation, or fight a situation, there's the other piece about kind of like being paralyzed by the situation. And I think that usually tends to being this what happens to many of us, that we are overwhelmed and we're paralyzed into taking action that is beneficial to us, because of our insecurities, because of our fears, because of what we think the other people may think of us, and those are ways in which our brains filters information, and then finds supporting evidence, even if it's not true. We may not see how much we've gotten done in the last couple of days. We will focus on the few things that didn't get done. We may not be seeing that we actually have been managing stress relatively okay given everything that's happening. We just focus on the moments that we just lost it for a few moments, and now we are being critical of ourselves. So like, I constantly ask people to find evidence to the contrary when it comes to your own self-perception. If you think you're not getting something right, look for evidence. I'm pretty sure there's got to be instances where you are getting it right. You're just not giving yourself the credit to be able to do so.
Yeah. And I would maybe just add too, I think it's really fascinating. If any one of us Googled right now common thinking errors, right? There's such
Mhm.
a long list of the ways that our minds kind of work things. I think of it a lot of almost like a filter, right? Like we think of like Snapchat or something like that.
Mhm.
You have all these different filters, but a lot of times I try to remind people sometimes we're seeing our experience through maybe the filter of depression, maybe the filter of anxiety or loneliness. And that really impacts how we view our actions, how we view our failures or successes. So I think that's always important to kind of keep in mind. I'm feeling this way, but is that the reality, right? Like Manny mentioned, where is the data coming from? Is this
Mhm.
accurate data? Can I trust this data? And I think that helps us really gain a little bit more perspective kind of moving forward.
And that's where being vulnerable helps, because when the moment we are willing to take that chance and say, hey, I don't know if you guys have been feeling this, but I feel like I've lost complete control out of my life. And everybody around you says, I've been feeling exactly the same thing. You realize, wait, I, I'm not the only one. And then you start realizing there are areas in which you are having control, because you allow yourself now to rid yourself of the fear or the judgment that was kind of like controlling your thought process in that moment. The other piece is you can get people to give you feedback to the contrary once you're able to kind of like let go of some of the fear. Like I told my wife the other day, this is just me being melodramatic. I said, babe, I've done nothing with my life. And she looked at me like, you lost your damn mind. That's what it is. And I just came from a place where I was feeling frustrated because I wanted to do something for a group of people and I didn't feel like I was having that impact. And then I was hearing about other people's work and I was like, oh man, they're doing it big. And I don't feel like I'm doing anything. And she put things in perspective for me real quick. She's like, you're saying this, but these are some of the accomplishments you've made in your life. This is how you have value to other people's life. And I was like, yes, I'm sorry. Yeah, I was in my feelings. I lost myself for a moment. So it's important to, if you can, if you have people that you trust, whose perspective you trust, who know you, and you can share with that, become vulnerable with them and share, listen, I've been struggling with this. That person can also help you regain some perspective, which is why, by the way, I think that the whole work with therapists is so important, because I went to my own counseling services, because despite the fact that I had my own degree and I've been doing this work for so long, I can't see what I can't see. I can't see my own blind spots. You know what I mean? And when we are being driven by anxiety or fear, or we are being driven by insecurities or whatever stories we've been telling ourselves for our lives, well, you know what? You're not even aware that this is the movie that's playing in your head. So you need somebody sometimes to just give you an outsider's perspective on what they're seeing.
And I will say, I think it's kind of interesting too, the role of language in all of this. So the first time I ever heard the expression, oh, I'm on the struggle bus, was in graduate school. And, we would do a lot of really nice check-ins each week to kind of see like, how are you doing? How are you doing between, your internship, between the papers you're writing, between life in general. And it was actually a very, very nice experience to see so many colleagues, so many friends being very honest about what was going on for them. And sometimes you would tell kind of in depth what was going on, or you needed to vent, and that was totally appropriate. But there were times where you were maybe a little bit drained, or maybe a lot drained, and you just didn't really want to get into all the detail. But just saying, I'm on the struggle bus, was enough for people to say, that was me last week, or that's probably going to be me tomorrow. And I still use that with my friends. So when I say that, they kind of know a little bit of what I might need from them, right? Maybe an extra phone call, maybe talking a little bit more. And that's really helpful, I think.
So I just read one, Helen. I just read your question. Thank you so much for sharing that. Do you mind sharing a little bit about what's been your experience
at the medical center?
Yes.
It's very crazy. It's very up and down.
So I'm sorry, do you mind if I read the question just so that
Go
people know?
right
Okay.
ahead. Go ahead.
So you're saying you're an essential employee, you have to work at the radiology department at St. Barnabas, and you do have to do diagnostic tests, including the COVID, for positive patients. And you've been dealing with a lot of anxiety because of that work that you're required to do, being in that space, correct?
Well, because our normal now is we have to make sure to take off our scrubs before we even get in our cars. And then we have to take off the rest of our clothes because we don't want to cross-contaminate still being in the hospital before we walk in our house.
Yeah.
So the normal is, and I have 2 children as well, and the normal is they run to me and say, hello, hi, mommy. And I'm like, no, don't touch me. I have to go upstairs. I have to shower. I have to change. I'll hug and kiss you after. And the biggest fear is to go into work, and we know we are treating COVID positive patients, and the possibility of getting one of our loved ones or family members or whoever we may have at home, because some coworkers, they do have their elderly family members at home currently, and getting them sick. That is our heightened fear every single day. So the only way that the hospital has come up with to manage that is to allow us to take days off during the week. So instead of having a 5-day work week, have a 3-day work week. And they'll minimize the amount of time we spend in the hospital. But regardless of, every single time we go in, there's an increased number of positive patients, and unfortunately, that's toll is increasing, and it becomes more real to us because in the last, I want to say, week and a half, we started off with 110 in the ER section. We have 2 for isolation and segregation, rather, in the ER department, and now we have a separate 10 for hospital workers who are feeling they are symptomatic. So it's very real, and it looks like a hazmat spill just spewed in the hospital every day.
Wow. Thank you for sharing that, because I know that was a very intense account of what's been going on, and I can only imagine what it's been like for you to live it. Believe it or not, I mean, and of course, I think I shared already that I work in the health field. I work at a medical clinic, and so I work at a community medical clinic, and this is exactly the experiences that we're having with the staff that are there. Where we're trying to provide support for them, and that was one of the experiences that I was saying was, I came home with frustration because I saw both ends of the spectrum. I saw that the needs that our patients have for care, and the fact that we are the one providing this care, and the meaningfulness of the work that we're doing. I mean, it's if we don't do it, at least in some of our communities, they won't have these available. So it is very meaningful, the work that we're doing. On the other hand, as you're describing it, it is very anxiety provoking as you're trying to, balance your own well-being, your own health, your children's needs. Same exact scenario where I have to come home, take off all my clothes through the garage, go straight into the shower, kind of like keep my kid away a few feet away from me, or my wife makes sure that she holds him up, puts him on a headlock, and puts him on the ground. No, I'm kidding. She doesn't put him on a headlock, but you know what I mean? Like, she has to keep him away because otherwise he will jump on me. And there is a lot of anxiety about that. And we've been trying to manage not only our anxiety, we're also dealing with our patients' anxieties, and then we're dealing with the co-workers' anxieties, the people who are around us who are expressing like, this is really frustrating. This is really upsetting. Some people are asking, why are we still here? And you have this conversation, and you can't help it but it becomes contagious. This level of anxiety just increases exponentially. So I wanted to validate that what you're describing is right in the midst of what's normal within this very insane situation that we're dealing with in the healthcare system, because we are essentially right in the midst of it, right? Jennifer, I don't know if there's anything. I'm at this point, I'm kind of like talking, and I will lose my mind talking for the next hour. I don't know. Jump in before I take talk for the next 20-25 minutes.
Well, I would just say I've noticed this has been a really interesting moment for myself, in the sense that my background is in health psychology. So I have done most of my placements, my different training opportunities have been either at hospitals or community mental health clinics, or some sort of integrated primary care. So I'm finding it really interesting hearing from some of my former colleagues, their experience. And I have colleagues in Chicago and in Denver, and it's so interesting because it's happening everywhere. One of my friends in Denver, she works as a psychologist at an integrated care clinic. And it was interesting because she told me some information about having to get tested, and thankfully everything is fine with her. So I'm over the moon, but it's a reality they're all facing. So I think it's just really difficult to manage it in the sense that you're going through it and then your friends are going through it or coworkers. It's a lot to take in. It really is.
One of the things that we've been kind of like helping the staff kind of like in terms of dealing with this, there's been this component of mindfulness that we've been promoting both within the clinic and also at home. And the idea is that when you are home, well, to back it up a little bit, is to acknowledge that we have to take the steps necessary to minimize the risk. And what I've done for it to be dealt with within my family is to communicate clearly as best as possible what our realities are on my end and what are the steps that I'm taking in order for us to be able to lessen the risks. Because I get their fear. Like I get that when they see me, they see one big ass coronavirus carrier, right? Even though I'm not, but that's what the fear drives them to see, right? So I had to sit down with my wife. I had to talk to my parents because my parents had, initially, they were like, "Oh, que tú te perdiste, you got lost." My Spanglish there, you got lost, and where are? And I'm like, "Dad, Mom, you know, you guys are over 60. You know, this is the situation. I am in the midst of dealing with patients who may be positive. I don't want to be accidentally a carrier that brings it to you guys. This is kind of like what I'm going to have to do for me to feel like I'm taking the necessary steps to keep you guys healthy." So the communication piece is going to be really, really important to kind of like discuss that, because otherwise it can feel very personal. Like the
And
first.
I just say thank you for saying that, because my mother's gonna be 69 and she finds it extremely disrespectful because she's an old school Colombian woman, born and raised there, came to this country, and she is like, you say hello, you say goodbye, and you hug and kiss, and I'm just like, I can't touch you. You have to understand, this is a different concept, this is a different animal. What you see on Primer Impacto
Yes.
is totally different from what I see at work, and I can't take videos of that unless I really want to lose my job.
Yeah.
It's the cultural aspect of it, because we're Hispanic and we're so friendly and it's like a need for physical touch. And
Yeah.
it's hard for me to explain, although you can't see it, it's real. Like, and then we have that fear and anxiety that we're talking about. Like, okay, I understand that you look at me and I'm your daughter or your cousin, but believe me when I tell you, I'm doing it for your protection.
Yeah.
And it's just hard to get that message across a lot of times. So
You know,
it adds to the stress.
yeah, and I speak to, I try my best to speak to their fears and to speak to their emotional anxieties and like, to just kind of like validate. I get you are concerned. I even go as far as to say thank you so much for taking steps to protect yourself and protect your family members. And by asking me, for example, to go take a shower immediately after I come inside the house, even though I'm already going to do that, but you still feel the need to say it. Well, thank you so much because I genuinely can see the interest in protecting me and protecting our kid and protecting each other, right? So being able to put that in perspective. So as we're practice being aware and being mindful of what's going on, being able to recognize the moment that we're living in, and saying this is it, I accept that this is my reality, but also expressing gratitude for the things that are there that can be appreciated, like the fact that I am able to do work with people that really need it, that I'm able to make a difference in people's life when I'm part of that mechanism, that system that brings health to the people that need it. And that's very valuable. And so I kind of like remind myself and remind others around me, which is also very helpful, just appreciating others by virtue of thanking other people for what they're doing. You feel good too. So that's something that I engage in all the time. Try to remind people, like, listen, this is something that is really meaningful. And then within that awareness, when you need a moment to either cry or let yourself be sad or deal with frustration, then be okay. Like, that's okay to just give yourself permission to express those emotions, because this is a very stressful situation. And I don't know if Jennifer wanted to add it.
Sure. I think the hope is that with enough kind of exposure from different sources, hopefully people will understand the severity or understand some of the limitations we have now, right, with everyday sort of physical contact. But I think sometimes too, it can be helpful, whether it's a parent or a child or a friend, if someone is really expressing to us kind of this desire for that intimacy or that contact, sometimes even being able to verbalize back to them, like, you know what, I miss it too. I'm really sad that I haven't been able to like kiss you on the cheek like I normally do, or I kind of miss holding your hand or something like that. I think that can be really reassuring to the other person. Like, oh, okay, I'm not the only one noticing there's been a shift in the relationship here. So I think that can be really helpful. But it's hard work. Every day there's new information coming out. And I think all you can really do at this point is try to validate someone's feelings, try to express what's in your heart, and then just kind of reiterate what's the main point here. All of these steps that we're taking that are not customary for us, the main goal is to try to keep us all safe. So I think that's kind of the most we can do with that right now. Yeah.
Absolutely.
For students who are, or Jen, if you could share can you talk a little bit about resources that are available, for students who are Seton Hall University students, like what can they do or what can they access in order to help them through this time?
Sure. So, the one thing I would say as kind of like the main support is really our website, and then also our main number. So the main number for CAPS, that's definitely still up and running. So even though we physically are not in the office anymore, we basically have a company that helps us traditionally with after-hour support. So what's happening now is that they are actually taking over the phone calls during the day as well. So if you call them with questions, they can help you in the immediate moment. If someone, for example, is having a panic attack, feels really anxious, or just really needs to talk to a clinician in that way. But then, for example, if a Seton Hall student is one of our regular clients, they are able to contact that number, and then basically that person, will take down information and give us the message. They contact one of the regular staff members to kind of help make sure we close the loop, and they get whatever resources they need. So we definitely can give people different information about local providers, things like that they can explore. But we're also trying to do different workshops and different work series. So basically at this point, I think today was the first time we did it, but on Wednesdays, I believe Wednesdays at 2, we're trying to have kind of a stress and anxiety sort of group available online. So the hope is that it'll be live, and students can participate, but then there's also, I think, going to be a recording of that. So all of this information can be on our website. And like I mentioned, we're going to be uploading some mindfulness exercises you can access for free. And then we're also working on something that'll be related to kind of scheduling and planning during this time. So I think that's one thing that's come up a lot for students. Just kind of, how do I get things done when it's such a chaotic time or such an uncertain time? So we're working on a little bit of information around that as well.
Thank you, Jen.
Sure.
I know. Go ahead.
Okay. So I used to live in the dorms, and now I'm living with my family, and I'm finding it really hard to kind of study and do my work because I'm used to really having my own space to do everything, with dorming for the last 3 years. So how do you kind of deal from going to a place where you are in a learning environment to a place where, it's your family and the house is kind of crowded and there's not really a place that you can go to really study?
So I think that going back to the original point about communication, this is going to be a challenging one because I think that it does presses it kind of like highlights some of the dynamics that you may have had already in terms of either communication or family dynamics that may sometimes affect whether or not you can do some of the work at home. Um, I when I was undergrad, it was a very similar experience where if I was home, the expectation that I needed to just be focused on whatever was going on at home was there, and that made it really challenging because then that meant that I wasn't going to be able to get my work done. If I was home, I needed to either go to the library, and I was a commuter, so my choices was the library, the Paris Cove, or I used to have to go to like a coffee place somewhere nearby. And I think that the challenge is being able to have a very clear, honest communication with your family about what is it that's going on, what is it that is at stake for you, what are your experiences, and then kind of creating or negotiating a space in which this would have to happen, and almost bringing them on as collaborators. Like, don't tell them necessarily, you may not be able to get them to listen to you by just simply telling them, I need from 4 to 5 every single day, this amount of, that might not work. But you may actually be able to make it work if you were to say to them, listen, what's at stake right now is that I have to finish this paper by Friday. I need at least 3 hours. Can we brainstorm? Can you help me figure out how we're going to figure this time so that I can get this done? Because otherwise, what will happen is I will fail this class, or this could have a detrimental effect on my grade, and then this is going to just affect everything that we've been working towards. Everything that we've been building up to this point is going to be affected by it. So having a very honest, you don't have to catastrophize it to the point where you're like, and then my life is over, because it may not be over, but you want to say with a certain level of reality what's at stake, and ask them and inviting them to help you problem solve for it. Any other suggestions, Jen?
That I think that covers a big part of it. So I would say, kind of like you mentioned, really focusing on the bigger picture, I think is important. And like you said, I think a lot of times we can get upset or angry with our parents, and it's kind of this quick reaction like, oh, well, I'm going to fail my test because of you, or like, look what you did. Now look what's going to happen now. So I think instead of having that mind frame, I think it's important to kind of change it around to, like you said, right, trying to say like, oh, like how can you help me, like, mom, I could really use your help, like this will help me probably get an A in this class, or that's going to make the difference, like that's going to help me maybe get that scholarship for next year. So I think when you help them feel like they're a big part of it, not part of the problem but part of the solution, I
Yes.
think that changes their reality, and that really is a benefit to everyone involved at that point.
And to close that loop, as soon as they give you the time and the space, just shower them with praise and
Hmm.
thankfulness. If there's nothing that makes people want to do something again than feeling good about the fact that I did this, and this is the reaction I got. So if right after they gave you the space that you needed, you come and you give them hugs and kisses, and you tell them how they're the best parents in the whole wide world, no matter what anybody else says, then guess what? That's going to reinforce that next time you make that ask, that you put that request, that's going to click in their head. They're going to remember, oh, last time my daughter or my son asked me for an hour, I was able to get this much praise. I want to do this again. I mean, they might not think about it consciously, but that's what's going to happen. And then you'll get the outcome that you want. Hopefully.
Thank you.
So
No
I have
problem. Thank you.
another question, kind of like, because I'm kind of in the same situation as her, but also like this concept of having space, because as of now, my sister's also living with us and she's working from home. So we're sharing like the dining room table. So it could get a little hectic. So how do you like kind of like deal with that? Because like there's kind of no other choice, but you still get like frustrated because you're trying to do your work and participate, but then your sister's like on a conference call like at the same time. So it kind of like,
Uh, I think that similar to what to the previous question, it's going to be about communication. It's going to be about coming up with a negotiated answer to what you and your sister's needs are and how to beat them together. And then being able to kind of like troubleshoot together as to present it as how can we be part of each other's solutions. as opposed to, you know, you're making my life impossible. Now, granted, there might be some times where sacrifices may need to be made, but the idea is everyone should feel like they're being heard and they are able to at least get the majority of their needs met by this communication.
Thank you.
I see your lips moving, but I don't hear anything yet.
Can you hear me now?
Yes.
Yes.
It was the headphones. So my question is, how can we be more motivated? Because with the school closed, libraries are closed, and I get distracted pretty easily. With this situation, I'm always home living with two other people. So it is hard for me to motivate myself to do my assignments on time. So what will be your suggestion on this? To get the motivation.
Motivation. Go ahead, Jennifer. Take it.
Sure. You know, I think there are always a couple different things that tend to work when we talk about motivation. So if we're thinking about something very kind of practical, I think there's always the idea that you can set different rewards in place for yourself, right? So the rewards you might have had like 4 months ago might look different now with some of the, you know, the context of what's going on right now. But I think really trying to find things, even if they seem like kind of small things, you know, we have the example of saying, okay, if I'm actually going to be watching Netflix or if I want to kind of finish off this season or the series, how can I establish some sort of routine where I say, okay, if I read, for every 2 chapters I read, I'm going to watch 2 episodes. If I'm going to study for 45 minutes, that means I get to maybe listen to that new CD I've been wanting to kind of hear. So I think there's always different ways of figuring out like what really what is your value, right? Like what's important to you that you currently do have access to, that you can realistically do, and then actually just trying to set up a schedule. I think that's one piece of it. I think at the same time, you know, we've talked a lot about the bigger picture. So even though it feels a little bit different now with being at home instead of being on campus or actually physically in the classroom, I think there's still ways to tap into the bigger value. So reminding ourselves, right? Okay, what is the purpose of me passing this class? I need this class for my major. Once I actually graduate this year, I move on to my next year. And then finally, I'm one step closer to graduation. It's kind of a series of events. So I think kind of keeping that in mind can be a nice way to say, okay, what was even the point of me going to college, right? Why did I start the process of applying to college? What's the point of me being here? And really tap into that passion or that feeling. And I think that's a nice way to kind of re-motivate ourselves and get back to that place of excitement that we had when we first walked into Seton Hall.
I think that to add to that, one of the things that sometimes becomes very challenging is that we think that we have to feel excited about the work in order for us to get started or feel like we're motivated to even begin. When the truth is that very first stage of getting something done is actually one of the hardest one. But there's a little part of our brain that once you start a task, it makes you feel the need to actually complete it. Like there's this function that kind of like, once you start doing something, you have this necessity to actually complete it. And I don't remember what the phenomenon is. And Jennifer, if you don't happen to know, you can throw it in there. But the idea is that make a commitment, a pre-commitment to getting whatever work started, right? And make a commitment to do it for 20 minutes, let's say. You're going to commit to doing 20 minutes of this paper that needs to be completed within the next few days. And chances are, once you get that 20 minutes done, or even make a commitment to 5 minutes, say, I'm going to sit down and write the title page and write the first 2 lines. Chances are, once you start that, you're likely to continue because you're able to overcome that barrier to entry to getting the work done. And then as you are getting the work into the work, then motivation it will follow, as opposed to waiting for you to feel motivated before you get started. Because chances are you may not tap into that motivation. There are days where I wake up and I'm like, I'm going to take over the world. I got this. And then 2 weeks go by and I'm like, I don't want to do anything, but it still needs to get done, right? So there are times where, motivation is going to be important, but other times where you just kind of like have to follow through on this pre-commitment, getting it done. And also, if you can, have somebody hold you accountable. When I was doing my dissertation, I went to a period of time where I wrote my first 3 chapters in like 2 months. And then it took me a year to get the data and another year to write up the last chapter. I mean, that's crazy that I wrote 3 chapters in 2 months, but it took me 2 years to complete the last two, and I didn't need to. And to get the last revisions done, literally, I had my wife I just told my wife, listen, I gotta get this done by June, or I just won't graduate. And I just put myself on fire. I wasn't motivated, but I made a pre-commitment, and then I had somebody hold me accountable. So that's the other piece that I think is really important. So I only have about 4 or 5 minutes left. I don't know if anybody has to stay on the phone, who wants to stay a little bit longer, but I have to leave in the next 4 or 5 minutes. Any other questions for me before I have to get off? Or any thoughts or comments?
I don't know if we have any other questions from the student group, but I know we've gone 22 minutes over time. So thank you, Manny and Jennifer, for staying on and just answering some of the questions that they had. We got some good feedback in the group chat. So if no one else has any questions, I think it's a good spot to kind of maybe deliver final thoughts before wrapping it up and thanking everybody for being here today. So I'll turn it back over to you guys for your final thoughts.
Okay. Well, I would love to say thank you for inviting me today. This was wonderful. I think at this time, I think going forward, it's going to be really important for us to remind ourselves that we're all doing the best we can within the situation. And I think that we need to allow for that flexibility, for that kindness to other people in our lives, but also to ourselves. And I really encourage all these students to kind of continue, right? I feel like this is part of your self-care, even making it a commitment to be here today and ask questions or kind of listen in. I think it shows that you're invested in trying to be proactive and make the best of a very unusual circumstance. So I think you guys should really thank yourselves for that.
Absolutely. Jennifer, are you guys offering any telehealth services during this time?
So what we're doing at the moment, unfortunately, we aren't able to really engage new students. So we've been offering more triage. So if someone needs kind of assistance in terms of their safety, in terms of locating a provider maybe closer to where they're at, because we also have students that have returned to their home states. So kind of throughout the US at this point, and also internationally. We've been doing that. But if someone is kind of an established student with CAPS, we are at this point offering some communication through either phone or also a platform called Doxy. So that is video sessions, which has been a unique experience for us as well, a very nice experience.
All right, cool. So my final thoughts real quick. I think that first, thank you. Thank you all for participating and for the wonderful questions and for showing such genuine interest in your own mental health. I think that from my perspective, and again, I'm biased because this is my field, but I think mental health and emotional well-being is probably the most important aspect of your life. Because everything is connected to that. Every aspect of your career, your relationships, your personal goal, everything is connected to whether or not you are emotionally and mentally well, right? So we want to encourage you guys to make it a part of your routine, your outlook in life. If in any way possible, try to always think about how do I incorporate some aspect of emotional well-being and mental health into my routine, and that can be physical activity, that can be eating healthier, right? But the idea is, how do I find ways to make sure that I'm feeling emotionally happy or that I'm dealing with things in a way that are effective or healthy for me on an emotional level. And I think that's my biggest takeaway, that there are going to be ups and downs. That's just part of life. This situation shall pass. We are, we are dealing with a pandemic, and hopefully this won't affect anyone directly in this group. But without a question, even if we were to do so, we would find ways, because this is our nature. We'll find ways to adapt, and we'll find ways to thrive and move forward. It is in our nature. And I think that the idea is find ways to incorporate mental health in your routine, and that will make it easier for us to deal with struggles that will come as part of being alive. All right. So thank you again.
Thank you guys so much. I love this session. Thank you to all the students who, came today and, virtually hung out with us for a little while. We hope that you take a lot of what we was said here today and really apply it into your daily quarantine lives and virtual sessions. So, I just want to wish everyone to continue to stay healthy, take care of your families, be kind to yourself, I think is the biggest message I got from today. And we do have another session tomorrow for resume building and job hunting, and a time of virtual interviews if you want to join at the same time tomorrow. But to Manny and to Jen, thank you so much for your time and your expertise, and we appreciate it so much.
Thank
and
you,
Anna,
guys.
thank you so much for putting everything together. This was really
Absolutely.
great.
Yeah, no, of course. So thank you guys. Bye everybody. Stay safe.
Bye.
Take care. Bye-bye.